Hi everyone, and we are welcome with another episode of the Transform series. It is so good to be back with all of you, and it is so good to be in connect with all of you. After yesterday's video, we got a lot of messages, and we are
We
very
had to come
thankful.
ahead.
We are very thankful for all the love that you give us. And today's episode is going to be purely dedicated to INICET paper, and specifically for people who are aiming the May 2026 INICET paper. So, reason I'm telling you this in the beginning is because whenever we are answering your queries, there will be some queries that you will have for other papers also. We will schedule a special session for you because yesterday we got a lot of messages by students कि सर एक बार INICET के लिए अलग से बात करते हैं. So first of all, foremost, you need to make an objective assessment of where you are right now and also an objective assessment of your preparation level. So for example, if you have if you have like done your first reading already and you are doing fairly well in the grand test. When we say fairly well, I would say maybe more than 130 correct or like that, or you feel that you know you are from a central institute, or you know only INI is your target,
Yeah.
then you will tweak the strategy because now you're not looking at the August NEET PG, you're only looking at the INICT. So if you're trending upwards, you're feeling confident, you have done your subjects, you feel you want to push harder for the May INICT, keep a few things in mind. Number one, INICT is the only paper in the country where half of the paper will be basic sciences. Even in the basic sciences, the second year subjects, your pathology, pharmacology, microbiology, will have more questions as compared to first year subjects. These basic sciences will be applied. Second thing, INICT is a paper which is highly predictable. Highly predictable. So that means they tend to repeat the same topics again. So if I now put things into perspective for you, if I was in your place, I would make a schedule in which I would not miss out on my second year subjects because I know that test half of the paper will be first, second year. I would not, miss out on any PYT. So I'll give you a pointer and ask Dr. DP to add on after that. I'll give you a pointer that in your app, in your revision course, you will see two short courses. One is Mission INICT, second is AIMS capsule. AIMS capsule is a shorter version, that is why it is the capsule. But they primarily deal with the PYQs of the INICT, and these are
PYT.
PYT based teaching by teachers. And I would make a schedule. Third thing I would do is that remaining 100 questions in the INICT will be clinical paper. These clinical papers, surgery, obs and gynae, PSM and medicine, in that order. Surgery, obs and gynae, PSM and then medicine, because medicine थोड़ा overlap बाकी subject से भी cover होगा. Then I'll come to the short subjects. In the short subjects, if you go for LRR, DVT, you're fairly well taken care of because INICT is not primarily testing short subjects. लेकिन रैंक लाने के लिए करने तो पड़ेंगे. जीरो तो कुछ करके हम एम्स में नहीं पहुंचेंगे. करने तो सारे सब्जेक्ट पढ़ेंगे. The priority will be for second year big clinical subjects like surgery, obs and gynae, PSM, medicine. In anatomy, you look at things like cadaveric images, embryology, which you find in your Mission INICT, as well as you find in your Back to Basics. In radiology, you try to go for radiological science, one-liners, latest Nobel Prize, new drugs. Take the cutoff date as March 31st for any new drugs or new programs that are coming. Try to balance this game and make a mental schedule. I would strongly recommend that on the DAMS app in the test and discussion, there is a special section called as INICT TND. And you might see the variety on the DAMS app that on the app TND, one cycle is going on which is NEET PG pattern test and discussion. Another cycle is going on which is INICT pattern test and discussion. If I was in your place, I would say कि अभी से लेके maybe till April I would do INI TND,
Yes.
mission INICT, and in the revision part I'll do the AIMS capsule, revise the PYQs again, and CBTs. There is a INICT CBT also that we have planned for you. So the timelines and the beginning, you have to keep in mind that if you are now reading anesthesia or the shorter subjects, that might not be a smarter strategy. You need to do second year MBBS, then first year. Big clinical subjects. In the big clinical subjects, prioritize surgical subjects over medical subjects. Then you go on to short subjects. शॉर्ट सब्जेक्ट टाइम आखिर में कम भी बच गया तो डीवीटी एलआरआर बहुत रहता है क्योंकि INI is mainly testing you on the bigger parts, the chunks of your medical knowledge that you acquire in your medical college curriculum. So biostats, don't miss out on biostats as well. In microbiology, they don't test you in the lab side of microbiology. They usually go into infectious disease perspective. So more think about patient कैसे आएगा, होगा क्या, diagnosis कैसे होगा, treatment कैसे होगा. Think of those arms. Also keep in mind, in an exam like INICET, in every block there will be some one-liners. So the paper is not exactly a long clinical paper. You will have a lot of one-liners also in the INI exam. I have seen in each block, so 50 question block would have 2 to 3 one-liners. Total 10 to 12 one-liners will be there in the paper. And any recent Nobel Prizes you should be thorough with. They are every alternate INI paper they ask the Nobel Prize winners. So I think that should set the tone. I'll ask Dr. DP to add on.
Right. So I'm going to talk about whatever Sir has said in a little more detail. Right. So starting with who are the ones who should change their strategy. Not everyone should, diverge from their track and start running, because even if you're preparing for NEET PG, you are not missing on INICT. You are still using it as a landmark, doing the best you are able to do, but at the same time, not compromising on things. So I would definitely agree with Dr. Sumay that if your number of correct questions is more than 125 to 130 correct, then yes, you can definitely think of swapping the strategy that I'm going to give for especially INICT. If your number of correct questions is less than this number, then I would say continue preparing for NEET PG and definitely give INICT with the best of your ability, because it will be like a good landmark. It will give you confidence. You will see that things are very doable, and you just need to polish yourself. You need to do more revisions. You need to work on your weak zones. Yes, so everybody is going to give the paper, but whether you should change the strategy or not, because if you keep changing strategy very often, you land up nowhere. So that is why, first of all, you should know, is it a good idea for me to swap the strategy now or not? So this is first question on who should swap to the new strategy that I'm talking about.
और ना ये सोचना ज़रूरी है कि क्या मेरा टारगेट नीट पीजी और आईएनआईसीटी दोनों है या सिर्फ आईएनआईसीटी है. बिकॉज इफ यू पुट ऑल योर बेट्स ऑन आईएनआईसीटी एंड इफ यू आर नॉट ऑन दैट जोन,
You're
द
losing
रिस्क इज द रिस्क इज कि नीट पीजी में फर्स्ट सेकंड ईयर उतना नहीं आएगा. नीट पीजी predominantly will be 60% of the paper will be third fourth year. First second year will be very straightforward. So NEET PG has a slightly different approach to it, where we would start from clinical subjects. Short subjects are more important in NEET PG. So वो छोड़ दिए क्योंकि हम INI कर रहे थे, लेकिन INI की अगर लेवल पे नहीं होगी तो गड़बड़ हो सकती है. So you have to make decisions like, am I targeting only INI-CT? Is that my mission? And I'm good enough to do it, or am I targeting both the paper? So that will change, and you flip the little bit of your strategy here and there. If I'm targeting both the exams, I'll again say, then it is a good idea to make a longer plan till the NEET PG, because NEET PG is far away from the INI paper. INI paper is in the middle of May, NEET PG is in end of August. So that gap period, if you are hurrying right now, तो फिर वो खत्म नहीं कर पाएंगे. And if you're starting now, it is a better idea to start targeting the NEET PG. उसके लिए बहुत टाइम है. नीट पीजी के लिए बहुत टाइम है. आईएनआई थोड़ा क्रैम्प है अगर अभी पढ़ना शुरू करें पहली बार. ये थोड़ा सा सोच के रखना है.
Absolutely. Now, again, I'm going to go with the exactly same things as Dr. Sumay said. So, he's given you the bigger picture. I'm going to break it down. So, now for anyone who is specifically targeting INICT, the most important thing is INICT TND. Yes, is it a must to? I would say yes. If your goal is INICT, then yes, because INICT TND like focuses only in a narrow zone of PYTs, which INICET is fond of asking, but it would go deeper in those topics because that's what INICET does. It's like a tunnel. It's narrow and very deep. What is NEET PG? Width. NEET PG may the variety of topics that are asked are more. They may not go into the very, very details of it, but the variety is definitely much more than INICET, right? So now what I have done is in the INICET, which is TND, which is actually a part of app TND, especially because there were so many requests on my WhatsApp channel today, Transform with Mentor Dams. So what we have done is we have today launched a special 3+1 month subscription in AppTND, so that people who are targeting only INICET can utilize this subscription. They use the INICET TND, and the best part is for these 3+1 months, you not just get INICET TND, you get all the revision courses, right? Which includes Mission, INICT, and AIMS capsule. You also get back to basics, which will have the PYT section. Remember, I told you the PYT PDFs? So, yes, today I've launched INICET or AppTND, a special subscription of 3+1 month. We are giving 1 month extra to give you exact coverage and probably a little more than the date of the exam to keep it, fair for everyone. So now what I'm going to do is I have framed a schedule on how to use this INICET TND uh, in this time, and I will be uploading this within the app TND itself. And I have made the schedule according to what Dr. Sumer has said, right? So, which means the test papers are already there, the video solutions are already there, but as so many of you are writing, ma'am, hame consistency nahi ban pati because we don't have a clearly defined schedule and we don't have a clearly defined strategy. So what I have done is I have exactly like Dr. Sumer said, divided your schedule into 3 phases. Okay. So I am going to, as I said, don't worry, I will be uploading this as well. So if you can see here, I'm just going to give you a broad outline. So there are going to be 3 to 4 PDFs that I will upload. The first PDF will have the schedule. For example, the phase 1 that I have kept, okay, is going to start from 10th of Feb, okay, and goes on to 13th of April, which means after this phase, you still have, this is like the total time. You have still have 1 month to revise and go and do the revisions with Mission INICT and AIMS capsule. So in this entire phase, which starts from 10th of Feb to 13th of April, I am going to divide your study into 3 phases. Phase 1, okay, is going to be basic and paraclinical sciences. Okay, so basic and paraclinical sciences, which is going to start from 10th of Feb, right? So what I have done is I have given you a test date. Okay, for example, I've given that 10th Feb ko you will do the anatomy INICET TND. Then, at a gap of 2 to 3 days, there will be physiology, then there'll be biochemistry. So, the first phase, which is going to end by 11th of March. So, we start from 10th April to 11th of March. And in this phase 1, we will be completing all the basic sciences, which means anatomy, physio, biochem. The second year subjects, which is path, pharma, micro, I am also including PSM in it because it is a big subject. Okay. So I am going to give you exact dates on when you should be appearing for those tests. And I am also going to upload another schedule where I am giving you how to go about your daily targets. So there will be a second PDF which is going to tell you what should you do on the test day, what should you do on the non-test day, and I have actually divided the time as well. जैसे कि सुबह से 7 to 10 a.m. what should you do, 10 to 12 a.m. what should you do, what should you do in the afternoon, what should you do in the evening. So the second PDF that I will upload will have daily time divisions, okay, what to do and when to do and in what order to do as well, right? The third PDF that I have included is going to include only your dates of giving INICT mock test papers. So with your app TND, you also get the entire test series, and there is a special section where we have uploaded special mock test papers for INICET. It's called as INICET mock papers. So the third PDF will have the exact dates on which you should be appearing for mocks, and I have planned 10 mocks for you in this time zone of 10th of Feb to 13th of April. Okay. So as I said, in the first phase, which is going to be from 10th Feb to 11th March, 1 month, we will be focusing on preclinicals and paraclinicals. So first and second year plus PSM. The second phase is going to start from 12th of March. Okay, so I'm going to upload this within the TND itself, as you can see here. So 12th of March, you are going to start with major clinical subjects. Like Dr. Samir was saying, that after you do the first and the second year, you should be focusing on the big clinical subjects, right? So 12th of March, we will be starting with big clinical subjects. So medicine, surgery, obs and gynae will go on the priority. Then we will include pediatrics, and then we will also include ophthalmology and ENT in this section. Okay. This is going to end from 12th March to 30th of March. ठीक है? So 12th March से 30th March तक is our second phase, okay, in which we are going to complete, or 2nd April actually, we are going to complete the clinical subjects, the big subjects, right, including your 3rd and 4th year clinical subjects. The phase 3, okay, which is the order in which Dr. Sumer was writing, the phase 3 will start from 3rd of April, and as I said, we will end it on 13th April, where you will cover your short and volatile subjects, right? So phase 3 is going to be short and volatile subjects. So as I said, I will upload this. Then, as I said, I'm going to show you. I have made special schedules for you to be following on the test day, and exact times on what you should be doing in what phase of time, so that you don't have to do any planning. The whole day I spent only to plan things for you so that you could use the resources to the best. I will also be uploading what you should be doing on the non-test day, so that we ensure that we are doing, the best of our ability in this coming time. So that is going to be PDF 2, which will include daily time slots. Okay. The third PDF, as I said, is going to be the schedule of your mock test papers. Everything is available within the AppTND course itself, nothing here and there. So these are 10 mock test papers that I have scheduled for you. They are specific to INICET. In between, so 10 mock test papers beginning from 10th of Feb to 13th of April. In between, if you want to give more GTs, they are all obviously there in your test series, so you can do that as well, right? So this is going to be the schedule that I will upload on how to use INICET TND day by day, starting from 10th of Feb. And as far as I am concerned, I will finish your schedule. I'll also give you a daily reminder. Okay, I'm going to be there for you. That's why we are now actively involved in the WhatsApp channel as well. Okay, so you will finish the reading with me through this schedule by 13th of April, after which you get whole 1 month, right, only for revisions. Okay, only for your weak zones. It is like 1 month of buffer time where you focus on your wrong diary, you focus on Mission INICT and AIMS capsule, and if you want, even DVT. So you will have complete 1 month after this schedule as a buffer for, completing any pendencies in case you have, for focusing only on intensive revisions through the short courses, which are revision courses specially for INICET. And as I said, there was no 3 month subscription in AppTND, but because I got many, many requests, that's why I've launched the 3+1 month subscription. And to make it most useful and effective, I've specially planned the schedule for you. So today by night, I will put up the schedule as PDFs within AppTND, within INICET TND 2026. Now look at the beauty for this. Okay. Please remember, when you join the AppTND, not only are you getting this, INICET TND, you're getting NEET PG TND. So as Dr. Sumer was saying, you can utilize this time up till INICET and use the INICET TND. There is another separate set of test papers which are available for NEET PG TND, which you can utilize from May until your, July, and then keep your August for revision. So you can utilize both, and that's how we would suggest to use. Also, If you are someone who wants to practice more and more tests, our app TND has more than one cycles. So you will actually have four different set of test papers. Two test papers for INICET. One is the most recent one, 2026. You will get one more set of test papers. Similarly, for NEET PG TND, you will get one latest 2026 papers and one more set of test papers. So it is actually a four set of test papers, all different, to give you the intensive testing revision, methodology. But as I said, please understand, first you have to decide, are you someone who should swap the strategy for INICET or not? Okay, बिकॉज अगर आप बहुत जल्दी जल्दी स्ट्रैटेजी स्वैप करोगे तो आप सिर्फ इधर उधर भागते रहोगे. So as Dr. Sumer said, please ensure that if you are targeting both exams, do not swap your strategy. Yes, and especially if your number of correct questions is a little less, then it is a good idea to keep following your schedule, right? Do the revisions with us. We are anyways going to do the revisions with DVT as well, with all of you, and DVT boot camps with all of you. Okay, so swap only when you feel that you are in the right zone to change strategy for INICET. The reason sir said that is कि INICET के लिए हमारे पास अभी फेब, मार्च, अप्रैल, यस 3 मंथ्स हैं. अगर हम बहुत तेज भागने की कोशिश करेंगे तो आप यू आर गोइंग टू कॉम्प्रोमाइज ऑन कंटेंट and then you will lag behind even for NEET PG, which is a much bigger exam with much bigger seats. Okay, so don't compromise on content too much. Okay, but yes, if your number of correct questions is anywhere above 125 to 130, you can start following this schedule that I will put up and start using the INICET TND. ठीक है. सो सर इसलिए चले गए क्योंकि ये पूरा स्ट्रैटेजी मैंने बनाया था. सर गेव मी अ ब्रॉड outline in the morning how I should be planning the schedule for you, and that's what he did in the first part of the session. Okay, and now I've given you the details and I will upload. Okay, so we'll upload the PDF for you so that you can start using it. You have the schedule is starting from 10th of February. Okay, so I've given you 1 to 2 days to to sink it in, to go through and see the strategy, and then you can start studying. Yes, and now once I'm done with the strategy, Dr. Sumer is back.
अच्छा, I think I saw Dr. Deepti was on a roll, so I thought कि एक बार मैं थोड़ा फटाफट से एक कॉफी मार के आता हूँ. And Madam has done an excellent job in creating such a wonderful detailed strategy for all of you. So अभी ना मैं कुछ और चीजें भी बताना चाहता हूँ. If you are a good student and you've always been doing well, and this is the time where you need to up your game. So अगर आपको लगता है कि आप किसी भी रिसोर्स से पढ़े हैं अभी तक और आपको लगता है नीड टू अप माय गेम, app TND is the ideal course. And specifically for the INICET, we have introduced this 3+1 month subscription, which is available already on your app. If you are not a damn student, but you want to up your game, this is the place to go. In the app TND, when you toggle the course, you see the INICET TND, and it is one of the most used course by the toppers and not told to others actually. ये वो चीज़ है जो टॉपर एक्चुअली इंटरव्यू में नहीं बता रहे, लेकिन सबसे ज्यादा इसको यूज कर रहे होते हैं. दिस इज द ओनली कोर्स इन द कंट्री विच इज ओनली फोकस्ड ऑन INICET TND test and discussion,
Okay,
INICET
I see a
pattern
query.
with the app TND.
Somebody is saying, can I do small modifications in my own way if I feel some subject is absolutely yes. This is a broad outline, especially because मैंने देखा है the problem with you youngsters is planning things. Okay, आप पढ़ लेते हो, मेहनत भी कर लेते हो, मगर planning और rules का push is what you need. So that is why I tried to do it for you so that आपका टाइम सिर्फ हर दिन प्लान बदलने में ना जाए, बिकॉज आई सी दैट्स व्हाट a lot of people keep doing. They keep changing their plans and then they say nothing works. If you don't work on your plan, how will the plan work? Okay, so इसीलिए it is just to help people to know exactly what to do, when to do, based on our experience, what we know about the exams, what we know about timelines, what we know about what topics are mandatory, how much depth is needed, which things you can avoid, right? And which things you should go in a big way for.
And it's very important to understand you must have selected a particular course for some reasons. Like for example, many of you are in a DAMS regular course, or in a app live course, or in a boot camp course. And when you come to that course, you're like कि मैं इस तरह से इस एग्जाम को टारगेट कर रहा हूँ. So if I'm telling you something else for some other exam, you might feel a little FOMO. But you have to stick to your original plans also कि मेरा ये आइडिया था, मैं तो अगस्त 30 को टारगेट कर रहा हूँ, तो मैं उस तरह से पढ़ूंगा क्योंकि मैं अभी शुरू कर रहा हूँ. So you need to do that iteration that I talked about in the beginning of the video today. So I'll before I ask Dr. Deepti to take some queries, I'll give you some reasons also. Why should you target INICET? I'll give you quick ideas for it. INICET is an exam which gives you admission to central institutes. Sir, सीटें तो कम होंगी. अभी ऐसा नहीं है. We have 23 aims. So the number of seats which are coming through INICET is significant. That is one good reason to target INICET. Number two, they pay good stipend. Number three, the exams and the MD exams, everything happens as per a curriculum. They never change their schedules. But even more important is, in a place like INICET, it will open your doors for future careers. Like for example, if you do your MD from AIMS, usually you'll get some priority, or you'll have that edge when you're appearing for DM in the AIMS entrance exam, which is called as INISS. So once you enter it, it will open your further doors. Many times faculty positions in different aims will open up. And if you are an insider, you are, or you already are a aims only, and you have that edge to take. Not only that, you get good peer group around. In the central institutes, the people who are joining PG with you will all be equally aggressive. तो उनको देख के आपको भी ज़िंदगी में ज़्यादा करने का मन करेगा. इट इज़ ऑलवेज़ अ गुड आइडिया इफ यू आर ऑन दैट ज़ोन. अगर लग रहा है मैं ठीक कर सकता हूँ, तो क्या मैं ठीक से बहुत अच्छा कर सकता हूँ? लेकिन अगर अभी शुरू कर रहे हो तो नीट और लॉजिस्टिकली ज़्यादा अच्छा टारगेट होगा. लेकिन अगर पहले से पढ़ रहे थे, तो इस समय गेम अप करना चाहते हो, तो INICET TND व्हिच इज़ अ पार्ट.
Okay, so two very important queries that I see. Number one, is DVT good for NEET? Absolutely yes. DVT इतना अच्छा है कि वो हर एग्जाम में हिट होगा. When to do it is the key. So as I said, the NEET TND schedule that I've made, it will finish on 13th of April. उसके बाद एक महीना है. तो order should be DVT क्योंकि DVT में coverage थोड़ी ज़्यादा है. And as you keep going closer to the exam, last 10 days, stick to Mission INICET and then stick to only AIMS capsule. See, every reading has to become shorter, shorter, shorter. है ना? इसीलिए please remember the order and the sequence is important. So DVT bootcamp जो है वो still it gives even more coverage than DVT. That is why DVT bootcamp अभी हो रहा है. DVT bootcamp खत्म होगा तो खाली DVT हो रहा है. Yes, so that is the purpose because you have to take some time to utilize the resource. So DVT alone is an excellent thing and should be stuck to in the last 1 month before the exam, especially NEET PG, especially INICET. INICET में क्योंकि वो नैरो पूछता है, क्लोज टू एग्जाम आप और नैरो पढ़ सकते हो. दैट इज व्हाई वी मेड मिशन INICET एंड एम्स कैप्सूल.
Acha, or even this app TND would give you access to the online DVT also. Online DVT is a part of this subscription, and some people are saying, "ये कहाँ पे subscription?" When you select your DAMS NEET PG as your learning objective, you will see plans like you will see a plan saying Deadly Combo. Then above that, you'll see Back to Basics. Above that, you will see App TND. When you click on App TND, you will see the months option, and we have recently introduced a new option for 3+1 month subscription targeting the May exam. And so reason that we are talking about at length is that when you target a big college, वो तभी आप करते हो जब आपको लग रहा होता है कि शायद मैं वहां पहुंच सकता हूँ. एंड यू आर ऑन दैट जोन. लेकिन उस जोन पे ना एक काफी सारे बच्चे हैं, तो मैं एक्स्ट्रा एज कैसे लूं? दैट इज द टारगेट, दैट इज द ऑडियंस दैट वी आर ट्राइंग टू एड्रेस टुडे इन दिस वीडियो. कि आपको लग रहा है कि यार मैं पहुंच तो रहा हूँ, लेकिन क्या मैं पेडल दबा के, क्या मैं मे बी F2 रेस का भाग हूँ, F3, क्या मैं Formula 1 का भाग बन सकता हूँ, या मैं एंड्रॉयड के ये सब फोन है, क्या मैं आईफोन ले सकता हूँ? सो दैट इज द एस्पिरेशन लेवल दैट यू हैव. So INICET is the cream where the best of the best medicos want to get into the best institutes.
Okay, the other very important query that I was saying was, कि ma'am, what if we are targeting NEET PG? Then is it okay to finish my course by March end? Absolutely, you
Take
don't
more
have
time.
to hurry
Take
at
more time.
all. Yes, अगर आप पहले से पढ़ रहे हो तो ठीक है, मार्च एंड इवन अप्रैल इज गुड इनफ। लेकिन अगर आप अभी शुरू कर रहे हो देन ऑल्सो यू हैव अ लॉट ऑफ टाइम, सो जून एंड इजीली वी कैन स्ट्रेच, maybe July also, for people who are starting now, it all depends on when you start. तो जब भी आप शुरू कर रहे हो 4 से 5 महीने आपको चाहिए टू प्रिपेयर फॉर द एग्जाम। सो अगर आप पहले से पढ़ते आ रहे हो, हमारे साथ नवंबर से पढ़ रहे हो, yes, it's a good idea. You can finish your course by March, start doing DVT with us. But very importantly, there will be a set of students who are going to start now. Is time enough for them? Yes. But our timelines will go further a little. है ना? So जैसे मैंने कहा, 4 महीने हमारा एक स्वीट स्पॉट है जब से हम शुरू करें, 4 से 5 महीने टू फिनिश your reading, so that you also have time for your revision later in 1 month close to the exam.
And as we will come closer to the exam, we will also have special sessions on how to give the paper, how aggressive you need to be. And today, to maybe whet your appetite, I'll just ask you, एक ना scroll back करना डैम्स चैनल के ऊपर, you will see many interviews of the last INICET toppers. रैंक 2 का दिखेगा, 3 का दिखेगा, 1 का दिखेगा, ऐसा उठा के उनका ना थोड़ा सा वीडियो देखना। आप मैंने जो भी इंटरव्यू लिया होगा, आई हैव आस्क्ड ईच वन ऑफ देम हाउ मेनी डिड यू अटेम्प्ट, व्हाट वाज योर स्ट्रैटेजी इन द फर्स्ट ब्लॉक, व्हाट वाज योर स्ट्रैटेजी इन द सेकंड ब्लॉक। उसको थोड़ा सुनना शुरू करना, एंड स्पेशली दैट विल गिव यू सम आइडियाज व्हिच यू विल रेजोनेट व्हेन आई टेल यू सब्सिक्वेंटली इन आवर एग्जाम स्किल डेज कि कितना एग्रेसिव जाना है, पहले ब्लॉक को कैसे मैनेज करना है। सो अभी हम सिर्फ बात करें टाइमलाइंस, स्ट्रैटेजी। क्लोजर टू द एग्जाम विल टॉक मोर अबाउट रिवीजन, more closer to the exam we'll talk about exam skill. So be on a lookout. If you have not subscribed to the channel so far, please subscribe to the channel, turn on notifications. We will keep coming back to take those queries. As of now, I just wanted you to know कि एक ना एक बहुत बड़ा इशू हो सकता है, कि हो सकता है आप बोलो कि सर मुझे पता ही नहीं मैं कहाँ हूँ, आई डोंट नो इफ आई एम गुड इनफ फॉर दिस और नॉट। आई वुड ऑलवेज सजेस्ट गो टू योर डैम्स ऐप, गिव आउट ग्रैंड टेस्ट। डैम्स के ग्रैंड टेस्ट आर ऑलमोस्ट जस्ट लाइक द रियल एग्जाम। इसकी योर डिफिकल्टी लेवल वही है जो असली एग्जाम का है। ऐसा नहीं कि कई लोग का थोड़ा मुश्किल ज्यादा बनाते हैं, कोई खराब करते हैं, ऐसा नहीं है। डैम्स का जीटी इज ऑलवेज मेड विद द आइडिया कि ये जीटी नीट पीजी को रिफ्लेक्ट करना चाहिए। सो गिव अ डैम्स ग्रैंड टेस्ट and see in which zone are you in. That will give you an insight. Don't give it to judge yourself, give it to get the baseline information. अगर वो बहुत 100 से भी नीचे करेक्ट जा रहा है एज ऑफ नाउ, तो आपको लगता है कि अभी मैं थोड़े कंसेप्ट्स बनाता हूँ, मैं नीट पीजी तक अपने आप को पिक करके नीट पीजी में टॉप रैंक निकाल दूंगा, अच्छा निकालूंगा, वो अच्छा आइडिया है। अगर वो 125 130 अभी आ रहा है, आप पहले से पढ़ रहे थे, अब आपको लग रहा है मुझे एक्स्ट्रा एज चाहिए, देन गो फॉर दिस ऐप टीएनडी विच इज द product that we are talking about for the INI paper. So don't confuse, it has to be based on your baseline today, because
Very
there
important.
is no solution which fits everyone. ऐसी कोई दवा नहीं है जो सबके लिए बनी है। आपके लिए अगर सही बन जाती है तो मैजिक हो जाता है। मैचिंग अ राइट कोर्स टू द राइट पर्सन creates magic, and that is what we are trying to do with our sessions every time when we talk about it. And that is why I told you at the beginning of the session today, this session is only aimed for people who are targeting May INICT with all seriousness. But if you say कि सर मैंने आज किताब खोल रहा हूँ और एक बच्चा 3 साल पहले से खोल के बैठा है, तो तू नीट को टारगेट करना, वहां पे और अच्छा टाइम मिल रहा है। Why are you missing out a big opportunity that the government, the God Almighty has given you with the 30th August paper? Massive timelines है वहां पे. So we'll keep talking about all those things again and again, but I hope the message is loud and clear. If you're on the right track, if you feel, if you smell victory, this is the time to press the pedal, and app TND is the product to push that pedal higher.
Okay. Now, please remember, no, online DVT, as I said, is going to be on 2 consecutive days. So even if you miss on one day, the same subjects might be repeated. You also have a recording available. You can always do that just in case there is a clash with one or the other classes as well. Okay. Now, somebody is saying that, yes, exactly. That is why exactly I've given more than 1 month ka buffer time. We are finishing on 13th April. If you want to miss a couple of tests in the INICT TND, you can always do them later. 13th April se leke 17th May, you have more than a month That is what I said. That is to cover your buffer zone for your pendencies or your weak zones or your wrong diary. Okay. So somebody was asking, ma'am, I've joined boot camp TND, which is going to start on 15th of March. So tab tak मैं क्या करूं? I would say till that time, spend time on revising your first and second year subjects. So anybody who has joined the TND boot camp, which starts on 15, no, I think 17th or 18th of March, from now until that time, cover ground on your first and second year subjects, revise them, right? So that you give yourself enough time and you're ready for the TND boot camp. Okay.
And also, it is also a good idea to strategize your PYQs also accordingly. NEET PG and FMGE exam are conducted by National Board. Their PYQs and topics are more relevant for those exams. INICET is primarily conducted by AIMS Delhi, and the INI previous year questions and AIMS 2000 to 14 previous year questions, which are there in your DAMS question bank, are more relevant for INICET paper. Also, we have introduced special PDFs. In your back to basics, we have introduced special PDFs called as PYT PDFs. INICT के PYT PDF भी आपके ऊपर हैं. अभी we have also put older AIMS PYT PDF also compiled, fully beautifully corrected for you, are there on your app. We believe they will be also a good idea for your final revision. उसको अभी से देखना शुरू कर दो कि एंड में ये मैंने रिवाइज करने हैं. So I think we've covered most of the things that you would have wanted to cover for the INICT paper. उसके अलावा एक चीज और जरूरी है. कभी कभी ऐसा हो सकता है आपको पता ही ना हो आप कितने अच्छे हो. यू मे बी अवॉइडिंग ग्रैंड टेस्ट और आपको पता ही ना हो आप कितने अच्छे हो, और हो सकता है आप सोच रहे हो कि मैं तो आईएनआई के लायक ही नहीं हूँ, और आप अपनी तैयारी नीट के हिसाब से कर रहे थे. But you took my advice and you appeared for a grand test and took that diagnostic grand test today yourself for tomorrow, and you found कि मैं तो 125-30 की रेंज में जा रहा हूँ, सर ने बोला मुझे तो पेडल दबाना है, and you reached INICT paper. That is the magic that strategy does to you. So you have to, if you are not aware मैं कहाँ हूँ, give a damn grand test today. Try to find where you are. अपना zone देखते हैं कितने correct का है. And we will open a window on the DAMS WhatsApp channel. We have already shared the link with you in the chat. आज के WhatsApp channel में I think we'll put up a question. How many corrects are you doing in your grand test, in your diagnostic grand test that you give today? एक आज या कल में देते ना. कल कल हम क्वेश्चन डाल देंगे. आज आप ग्रैंड टेस्ट दे दो, कल हम डालते हैं, आप उसमें आंसर करना, and we'll try our best to give some inputs based on those zones that you will put up there. मैं फिर से कहना चाहता हूँ, कोई भी बच्चा के खराब या सही नहीं होता. It is always about a journey and a start point. इस स्टार्ट पॉइंट को जानना बहुत जरूरी है. समटाइम्स व्हाट हैपेंस इज यू स्टार्ट कंपेयरिंग योर स्ट्रेटजी विद समवन हु स्टार्टेड 5 इयर्स बैक और 3 इयर्स बैक, और एंड आप आज शुरू कर रहे होते हो, तो अपने हिसाब से प्लान बनाना है. एंड समटाइम्स अ रॉन्ग स्ट्रेटजी माइट कॉस्ट यू अ प्रॉब्लम, बिकॉज आप अभी शुरू कर रहे थे, आपको लगा मैं तेज तेज भागता हूँ, जबकि उस तरफ पे नीट पीजी आ रहा था. आप नीट पीजी के लिए अगस्त तक बहुत टाइम है, आप बहुत अच्छा कॉन्सेप्ट बना सकते हो. सो मेक योर ओन प्लान अकॉर्डिंगली. Stick to a broad plan of your preparation. We will keep giving you tips and advices. Some of the advices in some videos will be targeted only to certain audience. For example, today's video is only targeted for May INICT paper. We'll come back with different papers later on also, but bhulna nahi hai, INICT is a good exam. Central institutes are good places to do your PG from. You get a good peer group, get good mentors, you see a lot of things. It opens a lot of doors for you. Many times when you go for an employment, if you say I am a postgraduate from AIMS or PGI Chandigarh, the other person knows that you're good. So it opens a lot of doors. ऐसा नहीं है कि बाकियों के दरवाजे नहीं खुलते, लेकिन INICT के द्वारा you can accelerate something happening for you. So it's a worthwhile effort. If you want to push harder, it's a worthwhile effort.
All right, so we will call it a day. And just as a reminder, every night, I am sharing a custom test from PYQs, okay, in the WhatsApp channel. And today's custom test PYQ will be from physiology. We have been revising physiology in the WhatsApp channel today. We first did in the morning a custom test from QBank physiology. Then we did uh, applied questions, MCQs on physiology in the WhatsApp channel. And at night, we are going to do the custom test for PYQs. Okay, so Look out for the custom test. I will share the code very soon and the link very soon on the WhatsApp channel. The diagnostic test can be any GT. It doesn't have to be an INICET mock test paper. It is okay. You can give any GT from DAMS app and see what is the number of correct questions. Okay, and then take the decision, take the plunge, and stick to the plan. Okay, that's how the plans work. All right. So take care, everyone. We'll see you again. We will. I'll keep posting, things on the questions on the WhatsApp channel to know what transform session you want now. Like today, I asked and everybody said we want to know about INICT preparation. So that's why we did a session today, and we'll keep coming back with more and more. Transform sessions. Hopefully, we will find out time and we'll keep coming back. Till then, you need to stick to your plans. Okay?
And tomorrow I am coming to DAMS Kerala. I am going to be coming to DAMS Kollam tomorrow for a radiology class, followed by Trivandrum. I have a long weekend ahead. I look forward to meeting all you, all our wonderful Damsonians from Kerala tomorrow. Looking forward to hear from you and looking forward to teach you to the best of my ability. I also want to tell you that this Transform series on YouTube is now linked to the WhatsApp channel. So what we keep doing is now we will keep taking live feedback from you on the WhatsApp channel कि तुम्हें क्या चाहिए, क्या पूछना है, and we'll keep answering there also. So we are trying to make it more and more interactive with you. Do follow DAM's WhatsApp channel. Don't miss it because that will give us an idea to stay connected, and we will be able to give you better advice based on what you exactly are asking. So wish you all the best. Have a great night ahead, and do let us know your scores in the diagnostic grand test that you will appear for today or tomorrow.